For that, we want to start off with the cell membranes. In the membranes, we have these phospholipids which undergo an enzyme called phospholipase, and they make an acid called arachidonic acid. So phospholipase itself can be inhibited by glucocorticoids. Now, I've made a whole video on immunosuppressants, but over there we spoke about glucocorticoids effect of NF-kappa beta. NF-kappa beta essentially means nuclear factor kappa beta. We also have IF-kappa beta, which means inhibitor factor kappa beta. Over there, what we want to do is that it will essentially, like the way I explained it, was NF-kappa beta goes to the nucleus and causes transcription, making a protein, DNA to RNA, RNA into proteins. Okay, what IF-kappa beta does is it's going to hold that, and when we phosphorylate, we get inflammation. So what glucocorticoids is going to do is going to get this, and it's going to lead to IF-kappa beta. Glucocorticoids also have a nerve function inhibiting phospholipase. We can go arachidonic. Let's go to leukotrienes. So leuko means white, and trienes just basically means like a 3 conjugated double bonds. So that makes 5-HPETE, which stands for hydroxyperoxyectorotonic acid. It's a mouthful, but it can also be there. Then we have over here this will then go act on the leukotriene, so leukotriene B4, and it will essentially lead to decreased amount of neutrophils. So you can learn this is leukotrienes is a neutrophil chemotatic agent. So neutrophil arrives before others. So that's going to be here. Then we can see over here that there's an enzyme called xyluton, which is leukotriene synthesis inhibitor. Then we have leukotriene receptors antagonists. So that can be, for example, montelukast or zafirlukast. Okay, so that's going to be leukotriene C4, D4, and E4. So that's going to be very effective, especially in some cases we're going to probably touch upon, or maybe not. So then we can see over here this NF-kappa beta is, as we spoke about, it's mainly for cyclooxygenase 2. The cyclooxygenase 2 and 1 make cyclic endoperoxides, and we can use aspirin, which irreversibly inhibits them. We also have NSAIDs such as naproxen, diclofenac, ibuprofen, indomethacin, all these drugs which are going to inhibit cyclooxygenases, but reversibly. Aspirin is irreversible. That's a really key difference I want you guys to learn. This celecoxib, a very important drug, it only inhibits cyclooxygenase number 2. When you inhibit that, you will decrease the amount of the prostaglandins, so you get plain, but you still have thromboxane made. So there is a risk of thrombosis over here, but you have decreased amount of prostaglandins. So you're pretty much chilling in terms of that. You want to know 5 main prostaglandins. You can make the prostaglandin I2, which is basically platelet gathering inhibitor, which can be potentiated by some drugs such as epoprostenol or iloprost. Then we can have prostacyclins, which is going to be prostaglandin E1, which is alprostadil or misoprostol. So that just causes vasodilation. Then we're going to have the prostaglandin E2, which is going to be for the contraction of the uterus. Prostaglandin F2 also for contraction of the uterus, which can be mimicked by dinoprost. Remember, dino as in E2, and F2A, which is going to be carboprost, which is also going to be there as well. And then we have the 5th one is thromboxane. So this is going to be leading to platelet aggregation and increased vessel tone. So prostaglandin I2 and E2, just I2 is just going to be basically decrease the vasotone. So acetaminophen, it inhibits cyclooxygenase, just like all other drugs do, but it does it reversibly. So it reversibly inhibits it, and it's going to be a really important point. It's going to be analgesic, it's going to be anti-inflammatory, but not antipyretic. It doesn't act at the brain. That's very important. It acts peripherally, so it's not antipyretic. One thing is that if we give this acetaminophen, if we take too much, we can get liver toxicity. That's because acetaminophen has a NAPQI. NAPQI, it decreases the amount of glutathione. When you decrease the amount of glutathione, you cannot antioxidate. So you get accumulation of oxidants, which can be quite damaging to your kidney, liver, and we can give N-acetylcysteine to treat that. So overdose causes a NAPQI, depletes glutathione, and that is N-acetylcysteine is a very good overdose over here. Aspirin, as I said, guys, is an irreversible inhibitor. I want you guys to know low, medium, and high. So low is going to be basically anti-platelet. That's its essential function. That's what we essentially give it for. Medium, you want to know anti-inflammatory and anti-analgesics. High is no antipyretic, because medium is going to be antipyretic and analgesic, and high is anti-inflammatory. So that's quite an important point that we should keep in mind over here. Guys, if you're of course decreasing your prostaglandin prostaglandin E1, you're going to be decreasing amount of blood to your stomach. and that's going to be leading to ulcers. You're going to be possibly getting some sort of ulcers which can be there. That's going to be problematic. We don't want any ulcers. Then we can see that there can be some tinnitus. This is a very important one. It can cause RAMA, which is respiratory acidosis, Norman anion gap metabolic acidosis. That's because you're accumulating the salicylic acid over here, and you want to give, if it's an acid, you want to give a base to treat that. So that's going to be sodium bicarbonate. There can be some sort of bleediness, especially with kidneys, so you're decreasing your prostaglandin E1, which is a vasodilator, and you're also decreasing the amount of prostaglandin I2, which is also a vasodilator and antiplatelet. So you're going to be getting decreased blood to the kidney, and that's kidney. It can also be allergic to the kidney acute interstitial nephritis, and so this is going to be over here. Celecoxib inhibits cyclic oxygenase number 2. That's going to be, it selectively inhibits it, which is going to be found in the inflammatory cells. And in the vascular endothelium mediates inflammation. So, but it would spare cyclic oxygenase number 1, which still helps you to maintain your prostaglandin I2 and E1, which are going to be your vasodilators and maintain it. But it does not have effect on the prostaglandin I2 and GI, and spares platelet function of thromboxane A2. So it would spare the platelet function of thromboxane A2, which is dependent on cyclic oxygenase number 1. So you can get more thrombosis. So that's the main thing. It's going to be used for rheumatoid osteoarthritis, but it's going to cause thrombosis and sulfur allergies. Okay, then we can come over here into NSAIDs. These are, we have 5 indices: ibuprofen, indomethacin, diclofenac, naproxen, and ketorolac. There are a few others, not too important. They again do the same thing. They cause, they reversibly inhibit cyclic oxygenase. They can cause interstitial nephritis. They can cause renal ischemia. They can, and GI ulcers. That's the main problem over here. That's where you go for celecoxib and aplastic anemia. Leflunomide, guys, not too important. It's gonna be dihydroorotate. They don't ask many questions on this on USMLE. Dihydroorotate dehydrogenase, which basically inhibits pyrimidine synthesis to decrease T cells. We can just use it for rheumatoid arthritis and psoriatic arthritis. I'm not going to spend too much time over there. Then we can come bisphosphonate. Is going to be alendronate, is a pyrophosphate analog. Basically, hydroxyapatite is a crystalline mineral form. It is the main mineral component of the bone, the teeth, and gives the hardness and gives them the strength. So that's going to be here. It binds hydroxyapatite and inhibits osteoclast. So we can use this for like many conditions: osteoporosis, Paget's disease, osteogenesis imperfecta, osteopetrosis, because you want to decrease osteoclast in all of these diseases. And we can see metastatic bone disease of bone. We can see over here that there's going to be, it can cause esophagitis, which is the main one. We don't need to learn avascular necrosis of the jaw. That's not an important one. Teriparatide is basically PTH. When we get more PTH, you're going to get more osteoblast activity, so very good for osteoporosis. It can cause many side effects, osteosarcoma, because you're getting more osteoblast activity. It can cause cancer. It can cause not used with radiation, Paget's disease, because again, you're going to get more amount of this. Then we can come over here to gout drugs. So gout drug, guys, we can, I'm just going to make a new video. I'm going to make a new video on gout drugs because it's getting a bit long here. I'm just going to recap over here. Essentially, guys, you want to know glucocorticoid has 2 functions: phospholipase A2, and it activates IF kappa beta, which inhibits NF kappa beta. Xylutrin inhibits 5-lipoxygenase. Leukotriene antagonists are going to be decreasing your, you're going to help you to decrease bronchial tone and decrease amount of neutrophils. We have these 4 types of prostaglandin, 1 thromboxane. Acetaminophen can cause toxicity. Aspirin, very important, guys. Low dose, you want to mention antiplatelet, which is essentially its function. At medium dose, it's going to be analgesic and antipyretic. At high dose, is anti-inflammatory. So then we can come over here. Bisphosphonate is very important. Many uses. You want to basically decrease the osteoclast that binds to hydroxyapatite of the bone, a pyrophosphate analog, because that's the main area. It's a crystalline form and inhibits osteoclast activity, used for many conditions. Hopefully you found this video. Hopefully you guys see you guys next time.